Welcome to Fit and Bold, where we promote healthy lifestyles. I'm your host, Lakita Goins. Today we're going to talk about hypertension, also known as high blood pressure. According to the Centers for Disease Control, about 1 in 3 American adults have hypertension. Hypertension can lead to stroke and heart disease, which are the number 3 and 1 causes of death in the United States. So we need to be aware, because many people don't know that they are affected by it. So we're here with Dr. Patel from the UAMS Area Health Education Center. How are you today, doctor?
I'm good. How are you?
Okay. So what is hypertension and why is it called a cardiovascular disease?
Well, hypertension is increase the blood pressure. Commonly people call it a blood pressure. Mm-hmm. So when the pressure inside the blood vessels increases, that's what we call as hypertension. Mm-hmm. We have certain numbers to diagnose that. If someone's blood pressure is above 140 or 90, that is called hypertension. Mm-hmm. And it varies people to people. Sometimes diabetic people have a different range and all that, which I'll discuss later. But why it is called cardiovascular disease? Because blood pressure is not just a blood vessel disease. Whenever you have a high blood pressure, it causes more stress on the heart as well. So it's like if you have a narrow pipe, the motor has to work overtime to work more extra to push the blood in through those vessels. So something like that. So that's why it's called cardiovascular disease and not just a vascular disease. Mm-hmm. So if you have a high blood pressure for a long time, you have some complication related to heart and all those. So it is combined. We do not say just a vascular disease, a cardiovascular disease.
Okay, what causes hypertension?
There are so many causes. We have 2 different types of hypertension. Most common is 95% of the hypertension is the essential hypertension, which we do not have identifiable cause as such. And other 5% are the secondary hypertension. So most of the time there is no specific cause you can blame it on, but we always have certain risk factors through which we can get the hypertension, but we cannot point towards one that this is the reason why it's happening. So most of the time it's essential, doesn't have any reason.
Right. So I read that sometimes symptoms of high blood pressure don't always show themselves. So what are the symptoms and when does someone with hypertension experience them?
Well, as far as hypertension is concerned, most of the time, and I'm saying most of the time, okay, people do not have symptoms until it reaches to a certain level. The blood pressure reaches to a certain level, then they start having symptoms. But overall, if someone has a headache, dizziness, nausea, and chest pain, shortness of breath more than usual, all these are the warning signs they need to get to a doctor. No matter if they do not have any other medical problems, they should get checked by a doctor and see a doctor. These are all some of the symptoms. Some symptoms can be related to, sometimes, like I said, it's a chronic disease, so people do not detect it initially. So by the time they realize they already have end organ damage. Sometimes you have symptoms of the end organ damage, like symptoms of the kidney failure, symptoms of the heart failure, symptoms of the stroke, heart attack. All these are the secondary symptoms if it is not diagnosed or diagnosed late.
Right. So some people may go to the doctor and find out they have high blood pressure, but because they don't have any symptoms, they may just choose to ignore it. What can happen as a result? I know you touched on some things, mm-hmm, but can you just kind of go back?
Sure. If the blood pressure or hypertension is not treated, and which is, again, very common in 1% of the people, that is 1 out of 100%, they have end organ damage by the time they realize they had even a history of high blood pressure. So that's why it's very important to take a look at your blood pressure and hypertension or blood pressure regularly. And the symptoms of those are, like I said, we have kidney failure. In that case, you do not make enough urine, or your urine is concentrated and you have swellings all around the body. You have congestive heart failure symptoms, you become short of breath, heaviness in the chest, or swelling in the lower extremities and swelling of the face. All these kind of the symptoms are the symptoms because of the end organ damage as such, and which is very serious matter.
Right, and you mentioned earlier that there are certain risk factors that increase your chances of hypertension. Can you talk to us about those risk factors?
Risk factors, we have actually two kind of risk factors. One is non-modifiable and one is modifiable. There are certain non-modifiable risk factors which we cannot do anything about it. Those are age. So after certain age, our vessels tend to become stiff. So that's why after 65 years of age, they tend to become hypertensive. Race, African American origin people have a high risk of having high blood pressure, which again we cannot change. These are non-modifiable. And female are protected because of the hormones in their body until the age of the menopause. So males are more prone to having high blood pressure. And all these are the non-modifiable risk factors. Now we talk about the modifiable risk factor. These are modifiable risk factors includes the things which we can do something about. These are sedentary lifestyle. That means if someone's sitting, not doing much at home, and their job is just a sitting job and not do much at home, even not much activity, that's one of the risk factors. Salt in the diet, and lack of activity, like I said. Smoking is a big risk factor. Alcohol, excessive alcohol intake, these are all the modifiable risk factor.
Okay, so I was going to ask you how we can prevent it, and that was it. No smoking, no...
Exactly. These are the things only we can change. So
right.
Stay away from the smoking, stay away from the excessive alcohol, stay away from sedentary lifestyle. And here's a caveat that people who are having a work where they walk, I've seen many of my patients arguing about it, that, oh, I do walk during my job, but which is not sufficient amount of work, because it's like in and out. How much calorie you take, you have to spend that much. Otherwise, it will cause all the weight gain and all kind of side effect and blood pressure issues.
So if a patient comes in and you think they may have hypertension, how do you test for that? How is that measured?
We have usually when the people go to the clinic, to doctor's office, or to anywhere in Walmart or somewhere, or any other pharmacy, they have a blood pressure cuff over there right in front of the pharmacy. Usually that cuff is called, we call it a sphygmomanometer. We put the cuff here where the blood vessels are, and we check the blood pressure at the level of the heart. So we put the blood pressure cuff here and blow some air in there, and we can know what your blood pressure is. That's how we usually measure it.
Okay, so what is high? Give us a number.
As far as the definition is concerned, high is anything above 140, systolic the higher one, and 90 is the lower one. So anything above 140 or 90 is high blood pressure. Doesn't matter if it's systolic or diastolic. If it's above 140 or 90, it's hypertension. And if it's above 130 but not quite 140, then it's a pre-hypertension.
Okay. So the last thing I want to ask you is will you talk to our audience and just give them some advice, tell them your thoughts on hypertension and going to the doctor?
Sure. For hypertension, like I said, it does not show any symptoms for a long time, and some people can have a very serious effect of if we do not treat it correctly. So it's very important to go see your doctor at least once or twice in a year to get your blood pressure checked and all the vital signs checked, so that we know how much is your blood pressure stays. And another thing is, if someone has a hypertension, I would say it's a chronic disease. So just the way the other chronic diseases are, they should be their own doctor. The doctors can advise them, they can give them the pills, but patients are responsible to keep checking the blood pressure periodically and keeping an eye on it to make sure that the pill is working, or is it working enough, or if we need something, we need to do something else.
Well, thank you, doctor. We've really learned I've learned some things, and hopefully our audience has too. So when we come back, we're going to give you our Fit and Bold healthy recipe pick. So stay tuned.
Thank you.
All right.
In the event of a car crash, 3 out of 4 kids are not as secure as they should be because their car seats are not used correctly. But the latch system makes it easier to get it right and to hold your kids tight. Anchor, tether, latch. Learn more at safercar.gov.
I took a trip to Elkhart, Indiana today. Elkhart's a place that has lost jobs faster than anywhere else in America. In 1 year, the unemployment rate went from 4.7% to 15.3%. Companies that have sustained this community for years are shedding jobs at an alarming speed. And the people who've lost them have no idea what to do or who to turn to. They can't pay their bills, and they've stopped spending money. And because they've stopped spending money, more businesses have been forced to lay off more workers. In fact, local TV stations have started running public service announcements that tell people where to find food banks, even as the food banks don't have enough to meet the demand. As we speak, similar scenes are playing out in cities and towns across America.
Welcome back to Fit and Bold. Today we've been learning about hypertension, and we want you to remember that a part of living healthy is eating healthy. So with that in mind, we're going to give you our Fit and Bold recipe pick. But first, remember to always consult with your doctor or nutritionist before trying any new recipe. So our Fit and Bold recipe is crispy potato skins. One of the methods of hypertension to control it from a dietary perspective is called the DASH method. It stands for Dietary Approach to Stopping Hypertension. So we have the crispy potato skins, and we're going to show you your ingredient list now. That includes 2 medium potatoes, or you can do as I did and choose 1 large baking potato. You need vegetable-based cooking oil, and you need minced rosemary, ground black pepper, 1/8 of a teaspoon, and optional, you can use reduced fat cheese. Also, garlic powder and onion powder can be used to taste, because one of the things about the DASH method is to reduce the intake of sodium. So there are 2 tiers of it. You can have a higher sodium diet and a lower sodium diet on the DASH method, but both of them are effective, and your nutritionist can tell you which one is better for you. So the first thing you do is you wash your potatoes, and you can cut them in half for faster cooking time, or you can leave them together, but either way you poke holes into the potato skin. Once you do this, you can put them in the oven. If you cut them in half, you only need about 30 minutes at a 375 heat setting. If you leave them whole, you need an hour. After you let them cook for 1 hour, you want to scoop out all of the pulp inside, and don't throw it away. You can use it for something else. Put it in a bowl, put it up. After you scoop out the insides, you want to sprinkle your rosemary on, your onion powder, your garlic powder, and I also like to add the tomatoes, and I added some chopped up spinach leaves, because the DASH method promotes Also eating lots of fruits and vegetables. So this will just top your fast meal out with a good vegetable. Then I also use reduced fat cheese. Some people may want to bypass this. But once you put everything in, you want to stick it back in the oven for 7 to 10 minutes. After that, you pull it out. You should have a good crispy texture on your potato skins. You can put them on a plate. I would let them cool a little first because potatoes tend to conduct heat really well, so they'll be really hot. But you'll be ready to eat your potatoes after that. Some other things we want to touch on, again, is the key goal to the DASH method is sodium intake. Also, you want to reduce the intake of red meats, sweets, poultry, and sugar beverages. So that includes your sodas and your sweet tea. You want to eat less saturated fats and less total fats. And that's why we use the vegetable-based cooking spray is better than actually using an oil, because you can use the minimum amount and still get the same effect. So once you do this, it takes a little while to cook, but it is a quick preparation meal. So you can cut it up, you can leave it in the oven and go do other things. And when you come back, you're ready to eat. And you can use it as a meal or a snack. And that's all for our Fit and Bold recipe. When we return, we'll be doing our exercising. So stay tuned.
When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who do something, the people who take action, are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
See where the good goes at goodgoes.org.
Welcome back to Fit and Bold. Today we've been learning about hypertension. A big part of living healthy is exercise. Remember to always consult with your physician before embarking upon any new exercise regimen. We're here today with Tyrell Meadows, a water aerobics instructor for the UAPB Wellness Program. How are you doing today?
Fine, and how are you?
I'm great. Tell us what we're going to be doing today.
Well, today we'll be doing some water aerobic exercises to help with hypertension, to relieve some stress and get you overall healthy and improve your mobility around, moving around and around the house, and the water helps with everything.
All right. Well, let's get ready to exercise.
All right. Hi, we're going to do some water aerobic exercises today to help you with your hypertension, to lower that blood pressure and get you overall healthy. All right, we're going to start off with the jumping jack, all right? Jumping jack in the water, okay? With the noodle, you'll squeeze the noodle like this, your legs will go out and back in. With the weights, they're down by your side, they're out and back down, just like that. We're going to go for a whole 30 seconds. Last 10 seconds, we're going to pick it up at the end. Everybody ready? All right, let's go. Exercise, go. Out and in. There you go. Make sure you keep your back straight. Make sure you're breathing in through your nose and out through your mouth. There you go. Got about 20 more seconds. Hang in there. Make sure you're squeezing as you go down. Squeeze with your thighs and your arms. There you go. Almost there. Okay, 10 more seconds. Pick it up a little bit. There you go. 5, 4, 3, 2, 1. All right, all right. We're gonna move on to our next exercise now, okay? All right, now we're gonna be doing cross country this time, okay? Cross country is just like your skiing. Your legs will stay straight, your knees don't bend, your arms are straight also, your weights are down here. With the noodle, it's the same thing. All you do is switch your legs, okay? All right, just like we're skiing. Ready, 5, 4, 3, 2, let's go. There you go, move that noodle back and forth. There you go. Switching those legs. Keep your core tight on this exercise. There you go. About 15 more seconds. Almost there. 5, 4, 3, 2, 1. All right. Now we're gonna do roll-ups, okay? It's just like you're running. You're doing a high knee with your legs, okay? And with the noodle or the weights, all you're gonna do is roll it in the water as you're running, okay? Keep your back straight, head up, core tight. All right, here we go. 5, 4, 3, 2, let's go. All right, roll it up. Make sure your head's up, chest up, rolling it in the water, getting those knees up. That's gonna help with your core strength. There you go. Make sure you're breathing in through your nose, out through your mouth. You have to breathe. Get the oxygen to your muscles. There you go. 10 more seconds. Come on, let's pick it up a little bit. There you go. 5, 4, 3, 2, 1. All right, good job, good job. All right, and then we repeat that, okay? That's a good job.
Well, I thoroughly enjoyed the water aerobics. I have a testimonial from Ms. Sharon Shavers in Accounts Payable. She wants our audience to know that she started line dancing in fall of 2011, and she also started walking a lot at that time. She wants to remind our audience to drink plenty of water. She has started increasing her water intake, and she wants everyone to know that she feels better than ever. And if she can do it, you can do it as well. If you are interested in line dancing, water aerobics, or lap swimming, Black and Gold Fit&Bold has all of those classes available now. And you can call 575-8000, press 0 at the prompt, and ask for Miss Cynthia Anderson or Miss Rita Gates. Also, Rose Hill Missionary Baptist Church has exercise classes Monday, Tuesdays, and Thursday. You can get more information at 870-536-4786. Shepherd Center has line dancing classes at the Lakeside Church, and they have Tai Chi classes as well. You can find more information on this by contacting Ms. Betty Johnson at 870-535-8037. I want everyone to remember that getting healthy is a lifestyle choice, and you can jump in your journey and be happy in it. So, until next time, get fit and be bold.